Good morning, everyone. Welcome to today's session. I'm Dr. Asim Hussein, and I'm excited to be here with you. Today, we'll be focusing on the OSCE and clinical examination, with a special quick deck on tuberous sclerosis, or TSC. Over the next few minutes, we'll cover the key features, clinical signs, and important aspects of diagnosing this condition. So let's get started. Let's start by discussing tuberous sclerosis, or TSC for short. First, we'll go over what it is and which systems it affects. TSC is a genetic disorder that causes benign tumors to develop in multiple organs, including the brain, skin, kidneys, heart, and eyes. Understanding the systems involved helps us recognize the diverse manifestations of the disease. Next, we'll look at how TSC presents during exams. Patients may have skin lesions like ash leaf spots or shagreen patches, neurological signs such as seizures or developmental delays. Recognizing these signs early is crucial for diagnosis. Then, we'll cover the key questions to ask during the patient's history. Important points include family history, any seizure activity, developmental milestones, and specific skin or organ-related symptoms. These questions help piece together the clinical picture. Following that, we'll go through the examination sequence and signs to look for. This includes inspecting the skin thoroughly, checking neurological function, and assessing other affected organs. Spotting characteristic signs can guide us toward the diagnosis. After that, we'll consider the differentials, other conditions that might mimic TSC, and what investigations are necessary. Imaging like MRI can reveal characteristic brain lesions, while genetic testing can confirm the diagnosis. Finally, we'll discuss management strategies and prepare for Viva questions. Management is multidisciplinary, involving neurologists, dermatologists, and other specialists, focusing on controlling seizures, monitoring organ involvement, and providing support. Throughout this presentation, keep in mind that understanding TSC's systemic nature helps us approach diagnosis and management holistically, ensuring we address all aspects of this complex condition. Let's take a closer look at the various systems affected by tuberous sclerosis, starting with the skin, which often shows visible signs like patches or spots. Moving to the eyes, where we might see retinal hamartomas. The heart is next, with possible cardiac tumors called rhabdomyomas. The kidneys are also commonly involved, developing renal angiomyolipomas. Then there are the lungs, especially in adult women, where lymphangioliomyomatosis can occur. The brain is a critical area, as tuberous sclerosis is primarily a neurodevelopmental disorder, leading to seizures and developmental delays. This condition is characterized by benign tumors known as hamartomas forming across multiple systems, which is why it's called a multi-system disorder. An important point to remember is the OSCE mindset. If you identify one feature, like a seizure or a skin lesion, make sure to screen for other associated systems. This comprehensive approach helps in early diagnosis and better management of the disorder. Next, we'll look at the targeted history we need to uncover multisystem involvement in tuberous sclerosis. When taking the history, it's important to consider several key areas. For example, if a child has poor progress at school or college, that could be a sign of neurodevelopmental issues related to the condition. In the renal and hypertension category, difficult-to-treat high blood pressure is a common concern, often linked to renal involvement. When it comes to respiratory symptoms, watch for shortness of breath or an ongoing cough, which might indicate pulmonary issues associated with tuberous sclerosis. In neurology, patients may report headaches, seizures, or fits, all of which suggest neurological involvement. And don't forget skin findings, such as a persistent rash on the face. These can be important clues as well. Finally, I want to highlight that these scenarios are common OSCE situations, so recognizing these signs can really help in making an accurate diagnosis and understanding the full scope of the disease. By connecting these different systems, we gain a comprehensive picture that guides us toward effective management. Let's start by asking open questions to get a sense of the patient's overall presentation. For respiratory concerns, I might ask, are you experiencing any shortness of breath? Or do you have any cough? These questions help us gauge the severity and nature of breathing issues. Moving on to neurology, I would inquire, are you experiencing headaches? Or do you feel weakness or numbness? It's also important to ask about seizures or episodes of turns, as these can be significant. Don't forget to ask about vision, hearing, or speech problems, which can also be key clues. Now, if the presenting complaint involves a rash, we need to gather specific details. Ask, when did the rash start? And how has it changed over time? The distribution on the body is also critical. Where exactly is the rash located? In the context of tuberous sclerosis, there's a specific checklist we should keep in mind. These questions help us piece together the clinical picture and determine if the patient meets criteria for diagnosis. So, by covering these areas thoroughly, we ensure we're gathering all the relevant information to guide our assessment and management. Let's now go through some important aspects of the patient's history that can give us valuable clues. First, we ask about habits such as smoking. Have they smoked or do they currently smoke? We also want to know about alcohol or drug use, as these can impact overall health and specific conditions. Next, mood is an important factor. Are they experiencing any depression, anxiety, or mood swings? If they have any particular worries or concerns, it's helpful to explore those as well, since psychological factors can sometimes influence physical health. Moving on to family history, we need to find out if anyone in the family has had a rash or similar medical problems, which could suggest a hereditary condition. Understanding the family background helps us identify genetic patterns, especially relevant in conditions like tuberous sclerosis. Now let's consider social and educational background. Who lives at home with the patient? What is their occupation? When did they leave school? And how are they performing academically? If they've attended college or university, that information can tell us about their developmental history. Switching to renal and urinary history, we should ask if they have any trouble passing urine, or if they notice blood in their urine. Any abdominal swelling. Also, do they have a history of hypertension or kidney issues? These are key questions since kidney problems often relate to systemic conditions like tuberous sclerosis. In the final part, we review past medical history and medications. Are there any other medical issues? Have they had any operations before? What medications are they currently taking? And do they have any allergies? Lastly, for tuberous sclerosis specifically, it's crucial to gather a detailed history checklist. This helps us identify signs and symptoms associated with this condition, ensuring we don't miss important clues that could guide diagnosis and management. Let's start with the patient comfortably seated, ideally with the top of the gown pulled up to allow for a thorough examination. First, I'll examine the hands for any tremors and nail changes, such as fibromas, which are common in tuberous sclerosis. Moving up to the arms, I'll scan for an AV fistula if the patient has a history of dialysis, and I'll also check their blood pressure to assess for hypertension, which can be associated with the condition. Next, I'll inspect the face for any facial rash, specifically angiofibromas, which are characteristic skin lesions in tuberous sclerosis. Then, I'll look inside the mouth, paying close attention to the palate and gums for hypertrophy, which can sometimes be seen. Moving to the neck, I'll check for scars that might indicate prior surgeries or interventions. On the thorax, I'll look for ash leaf macules, which are hypopigmented patches that are quite distinctive. For the abdomen, I'll examine for any scars from peritoneal dialysis or kidney transplants, and gently ballot the kidneys to assess their size and position, as renal involvement is common. Turning to the back, I'll ask the patient to sit forward so I can inspect for additional scars and look for a shagreen patch, which appears as a leathery, textured skin lesion. I'll also auscultate the lungs to check for any respiratory issues. If time permits, I'll proceed with a cardiac examination and then perform fundoscopy to look for retinal hamartomas or other ocular findings associated with tuberous sclerosis. This systematic approach helps us identify the key features of tuberous sclerosis and assess the extent of systemic involvement. Let's take a closer look at some of the key skin signs associated with tuberous sclerosis. First, we have periungual fibromas, which are small, fleshy tumors that typically arise from the nail beds. These are also known as Conan's tumors. It's important to check both the hands and feet, as they can appear in multiple locations. Next, there's the shagreen patch, which is a leathery, textured plaque usually found over the lumbar region. This skin change is quite characteristic and can be a helpful clue in diagnosis. Moving on, we see the ash leaf macules. These are hypomelanotic spots, meaning they are lighter patches of skin. Under Wood's lamp, these areas will fluoresce, making them easier to identify. Lastly, facial angiofibromas, also called adenoma sebaceum, typically present as small papules in a butterfly distribution across the face. Recognizing these cutaneous signs is crucial, as they often reflect underlying neurological and systemic involvement in tuberous sclerosis. Connecting all these signs helps us build a comprehensive clinical picture and reinforces the importance of thorough skin examinations in suspected cases. Let's move on to the neurological assessment. Here, we perform a brief focal screen to quickly check for any neurological deficits. If the patient reports any issues or if there are signs during the exam, it's important to investigate further to identify specific deficits. Next, we look at the cardiac system. In tuberous sclerosis, one of the common findings is the presence of rhabdomyomas, which are benign cardiac tumors. These can sometimes cause murmurs, so auscultation can provide valuable clues. Turning to the renal system, we often see angiomyolipomas, which are benign tumors composed of blood vessels, muscle, and fat. These can lead to the kidneys feeling palatable, meaning they can be pushed or moved slightly during examination. Also, be aware of AV fistulas or scars that might suggest prior interventions or vascular anomalies. In the eye examination, fundoscopy can reveal retinal phacomas, which are characteristic lesions in tuberous sclerosis. These may appear as gray, white, or yellow patches on the retina. Overall, these systemic findings, neurological, cardiac, renal, and ocular, are key features in tuberous sclerosis. Recognizing these signs helps us build a comprehensive picture of the disease and guides further management. Let's take a closer look at von Hippel-Lindau syndrome. This condition is characterized by the presence of cysts in the kidneys, pancreas, and liver, which are important to recognize. Additionally, patients often develop hemangioblastomas, particularly in the cerebellum, which can affect balance and coordination. Retinal angiomas are also common, potentially impacting vision. It's crucial to remember that there is a high risk of developing renal cell carcinoma, or RCC, and also pheochromocytomas, which are tumors of the adrenal glands. These features highlight the importance of vigilant screening and management in VHL. Now, shifting gears to neurofibromatosis type 1, or NF1. The hallmark features include caféolate spots, those pigmented skin patches that are often the first signs. Neurofibromas, which are benign nerve sheath tumors, are another key feature. Axillary freckling or freckles in the armpit area is also characteristic, along with Lisch nodules. These are pigmented iris hamartomas that can be seen during eye exams. Recognizing these features helps differentiate NF1 from other neurocutaneous syndromes. Finally, let's briefly touch on the key differentials of tuberous sclerosis. While not as detailed on the slide, it's important to keep in mind that tuberous sclerosis presents with a different set of features, including skin lesions like ash leaf spots, and neurological manifestations such as seizures and developmental delays. Understanding these distinctions is essential as we move toward accurate diagnosis and tailored management for each condition. Throughout this presentation, our goal is to understand these syndromes' unique features so we can better identify, differentiate, and treat our patients effectively. Let's go through the investigations we typically consider, starting with bedside tests. First, a Wood's lamp examination, especially useful for identifying ash leaf spots, which are characteristic of tuberous sclerosis. We also check blood pressure to screen for hypertension and a urine dipstick to look for hematuria, which might indicate renal involvement. An ECG is important too, to detect conduction blocks or conditions like WPW syndrome, which can be associated with tuberous sclerosis. Moving on to blood tests, we want to assess renal function with U and E's, since kidney lesions are common. A full blood count helps us identify anemia, which can result from hematuria or other issues related to the disease. Regarding imaging, MRI of the brain is crucial for identifying tumors. These are the characteristic cortical malformations. Renal ultrasound or MRI helps us find angiomyolipomas, which are common renal tumors in these patients. A CT scan of the chest is useful to detect lymphangioliomyomatosis, or LAM, and any pneumothorax, which patients are at risk for. An echocardiogram can reveal rhabdomyomas, which often involve the heart. Finally, in some cases, especially if lung involvement is suspected, spirometry becomes valuable to assess lung function and involvement more precisely. Altogether, these investigations help us build a comprehensive picture of the multisystem involvement in tuberous sclerosis, guiding diagnosis and management effectively. When it comes to surgical options, we might consider procedures like renal transplant in severe cases, especially if kidney function is significantly affected. Excision of large lesions can also be performed to prevent complications, and in cases of bleeding angiomyolipomas, embolization is a minimally invasive way to control hemorrhage. On the medical side, managing associated conditions is crucial. This includes treating comorbidities such as epilepsy and renal disease, which are common in these patients and can significantly impact their overall health and quality of life. Non-pharmacological approaches are just as important. Patient education plays a vital role, ensuring patients understand their condition and how to manage it day to day. Providing written information helps reinforce this knowledge and supports better adherence to management plans. Genetically, it's important to remember that tuberous sclerosis has a 50% transmission risk if inherited in an autosomal dominant pattern. This means there's a significant chance that it can be passed down from parent to child, so family planning and genetic counseling are essential. To coordinate care effectively, a multidisciplinary team approach is best. This involves neurologists, nephrologists, and geneticists working together to address the complex needs of these patients comprehensively. Regarding epilepsy safety, patients should be advised to notify the DVLA if they are drivers, and take precautions such as shower safety to prevent accidents during seizures. It's all about minimizing risks and ensuring safety in daily life. Overall, managing tuberous sclerosis involves a combination of surgical and medical interventions, patient education, genetic considerations, and safety measures, all aimed at improving patient outcomes and quality of life. Let's now look at the renal complications associated with tuberous sclerosis. One of the main issues we see is angiomyolipomas, which can sometimes bleed or even rupture, leading to significant problems. Additionally, patients may develop renal cysts, and in severe cases, this can progress to renal failure. Importantly, there's also a high risk of renal cell carcinoma, or RCC, which emphasizes the need for careful monitoring. Moving on to why renal cystic disease occurs in TSC. It's because the TSC2 gene is located right next to the ADPKD1 gene on chromosome 16. This proximity often results in what's called a contiguous gene syndrome, meaning patients can manifest features of both diseases simultaneously. Now, regarding the mode of inheritance, tuberous sclerosis is inherited in an autosomal dominant pattern. The responsible genes are on chromosome 9, which encodes TSC1 or hamartin, and on chromosome 16, which encodes TSC2 or tuberin. Understanding this inheritance pattern helps us grasp the hereditary nature of the disease and the importance of family screening. Good luck in your OSCE. When you're evaluating cases of tuberous sclerosis, remember to think about multisystem involvement. It's a condition that affects many parts of the body, so keeping that in mind is crucial. The skin signs are often the first clue and can really help with diagnosis, so pay close attention to any skin manifestations. Don't forget to screen the kidneys, lungs, and brain, as these are commonly affected organs. To sum up the key takeaways, always consider the broad spectrum of systems involved, look for characteristic skin signs, and ensure comprehensive screening. This holistic approach will serve you well in managing and diagnosing tuberous sclerosis effectively.